Hi, I'm Brenda Curtright. Welcome to my channel where I talk about strategies and tips on how to improve brain health. And today I'm talking about reminiscent therapy and how that can help you as a caretaker help someone in your family who may be experiencing dementia in terms of improving their communication, their cognition, which is just their brain health in general, and their mood and overall quality of life. Okay, so I'm going to talk about some recommendations from Alzheimer's.org today. A few of very good recommendations on how a caregiver can use reminiscent therapy to engage with their family or friend with dementia. So reminiscent therapy has been around since the 70s, and it helps people with dementia to basically improve their cognition, and it gives the brain some stimulation. It taps into their long-term memory. People with dementia have a problem with learning new information, and they are more likely to have access to long-term memories. And so that's what this taps into. It's therapy that could be done in a therapy office, because I do it as a therapist with people who come in to see me, but it can also be done with a caregiver. And so the idea is the big picture goal is to engage the person who you're having a conversation with in a meaningful way. There's no rules on how long it needs to be. And there are some general recommendations, though, that the questions should be open-ended, that you should follow the lead of the person who's talking. You should affirm what they're saying. So, basically acknowledge them and make that eye contact and listen. The also important thing is to have good wait time. Up to 30 seconds. There's no real hard rule, but 30 seconds is a good amount of time to wait. And you can gauge that by counting to 20. Okay, slowly to 20. And that can take you to about 30 seconds if you count slowly enough. That's a recommendation from Alzheimer's.org. To count from 1 to 15 or 1 to 20. So give that a try. The next thing to think about are the questions that you're going to ask. So open-ended questions would be things like, tell me about a favorite memory when you were younger. Tell me about a favorite trip that you've been on or vacation. Tell me about a favorite holiday that you've had, or tell me about a holiday that you've enjoyed and a tradition that you've done or participated in, versus what is your favorite food? What is your favorite holiday? So by saying, tell me about, you're making it more open-ended and giving them more room to say more to you rather than trying to search for a one-word answer. So the key, though, is to give them that wait time after you ask the question. And if they don't answer, you can either let it go and maybe change subject, talk about something else. Or if you happen to have anything like photos, videos, audio recordings, knowledge of their favorite song that you can play, souvenirs, or even something that is a favorite smell that they like, that you can share with them and then ask them to tell you about it. That would be a really good support, because sometimes having those things helps a person remember even better, even more quickly. So that would be a good idea. And the other big picture piece is to stay positive. If you notice any negative feelings that this is bringing about, you definitely don't want to cause that kind of a reaction. So you would maybe want to change the subject and move on to something else. Maybe ask another question, or just stop the activity at that point and just do something else. But because you could have a short conversation, or it could be longer where you could keep going, but you could just stop. But the idea is that this is going to give the person a sense of self, a sense of meaning, and give them a good feeling, most likely, and hopefully just give them a good quality of life. If you are willing to engage with them and give it a try. So I highly encourage you to do that and give a report. Let us know how you do with it. Come back and put some comments below, and let us learn from what your experience is. So I want to say thank you for joining today, and I would love you to subscribe to my channel and also ring the bell so that you can be notified of future videos. I like to talk about good communication strategies and tips for people who are having mild cognitive impairment and more major cognitive impairment, such as dementia. So thank you for joining today. See you next time.